Shri Gurubhyo Namaha. Good morning to one and all. Offering my humble pranams at the divine feet of Lord Dhanvantari. Myself, Dr. Kiran Kumar Chandrasekhar Budhihar, second year PG scholar, Department of PG Studies in Kaya Chikitsa, Government Ayurveda Medical College, Mysuru. It gives me an immense pleasure and honor to host this virtual event. I offer my salutations to the eminent personality of Ayurveda and guest speaker for today's session, Dr. Sunil Vasishta, consultant physician and Ayurvedic cardiologist at Dr. Vasishta's Ayurvedic Center and Heart Clinic, Jammu. I extend my salutations to our beloved principal, Dr. V. Radhakrishna Ram Rao sir. Further, I extend my salutations to our beloved Dr. R.C. Maitreya ma'am, Professor and Head of the Department, Department of PG Studies in Kaya Chikitsa, GAMC, Mysuru. And also, I extend my salutations to all the faculties of Department of PG Studies in Kaya Chikitsa and also all the HODs and faculties of all the PG departments of Government Ayurveda Medical College of Mysuru. A warm welcome to all the dignitaries and PG and UG students of GMC Mysuru. Last but not the least, all the viewers who virtually and actively participating in Hriday Prabodha 23, a national level webinar series on the eve of Golden Jubilee celebration organized by Department of PG Studies in Kaya Chikitsa, Government Ayurveda Medical College of Mysuru. Heart, the pumping organ of the circulatory system, which is situated in the middle mediastinum, enclosed within the pericardium, along with the great vessels. Optimum and efficient circulation of the blood throughout the body ensures proper nutrition, excretion, gaseous exchange, thermoregulation, and homeostasis, digestion, metabolism, intelligence, immunity, and ultimately life in the body. This fairly explains the importance of this four-chambered organ and its vulnerability to any kind of disturbances in the human body. That's why cardiovascular diseases are being leading cause of death worldwide, and also 80% of burden causing in developed countries. In Ayurveda, the term Hridaya denotes an organ which controls the passage of prana by collecting and distributing in a rhythm. That is Harati, Dadati, Yati. That is cardiac input, cardiac output, and circulation. Though Rudroga is not considered as Mahagada, but the utmost importance and priority has been given to Hridaya by mentioning it under Trimarma, Dashapranayatana, Chetanadhisthana, and Vyapatti in many of the disorders, and so on. This duly signifies the importance and essentiality and necessity to understand the clinical aspects of the heart and implications of the management. So becoming a cardiologist is a big dream. Nowadays, it is quite easy to pursue through the conventional science, but it is an imagination and hardest thing to achieve through the Ayurveda because the reasons are lack of dushta karmata, that we have not seen ample cases of CVD successfully treated, and other one, misconception or discourage that Ayurveda practitioners cannot save the patient life. The cardiology has much evolved and well established super specialty in conventional science, but not in case of the Ayurveda. So today we have Dr. Sunil Vasishta sir, who has made cardiology as a subspecialty in his impeccable career. Now I would like to invite Dr. Sangeeta, first year PG scholar from the Department of Kaya Chikitsa, to introduce the stalwart of Ayurveda to this virtual platform. Over to you.
Om Gurubhyo Namaha. Good morning, everyone. I welcome you all to the day of Hridaya Prabodha 2023, a national webinar series organized on the eve of Golden Jubilee celebrations by Department of PG Studies in Kaya Chikitsa, Government Ayurvedic Medical College, Mysuru. I, Dr. Sangeeta N, first year PG scholar, feels privileged to introduce our today's chief guest, Dr. Sunil Vasishta sir, consultant physician and Ayurvedic cardiologist at Dr. Vashish Ayurvedic Center and Heart Clinic, Jammu and Kashmir. Sir has completed his BMS in the year 1981 from Jammu University and completed his post-graduation in Kaya Chikitsa from one of the esteemed universities at Banaras Hindu University in the year 1984. Sir has also completed his PhD in Hridroga in the year 1987. Sir has published 23 articles in the national and international peer-reviewed journals, attended 44 conferences, arranged 110 seminars and conferences. Sir has also published 2 books. He has been a guest speaker for 168 offline seminars and 550 online webinars. Sir is also the co-founder and managing director of Dr. Vashish Ayur Remedies, Ahmedabad, Gujarat. Sir is presently working as consultant physician and Ayurvedic cardiologist at Dr. Vashish Ayurveda Center and Heart Clinic, Jammu and Kashmir. With this brief introduction, I would like to hand over this platform to Dr. Vashish sir for the most awaited session. Handing over to you, sir.
Words that reminds me of my past. So friends, namaskar. It's a great morning today to be with you. I really thank the organizers, particularly Dr. Maitreyi ji and Dr. Annapurna ji to give me a chance to be with you this morning. I hope you can see me and listen me well. Is it fine? Give me an
Yes,
indication.
sir.
Yeah,
Yes, sir.
okay, fine. Okay, fine. Friends, can you tell me the time I have to take to speak to you guys? Duration?
So 1 to 1.5 hours.
1 to 1 hour?
1.5 hours. So you
Okay,
can
okay,
extend,
fine.
sir. You can speak. Yes, sir. You can
You
speak.
let me know when to finish. Okay. Okay, friends.
Okay, sir.
Like you guys, I'm also an Ayurveda student. I got admission in Government Ayurveda College Jammu in 1987, 75, sorry, 75. I completed in 81 my BAMS. I had my MD in 84 and PhD 87. I was in the teaching faculty at Gujarat Ayurveda University, Jamnagar, Kachkissa for a couple of years. And I had a long career of more than 40 years in my practice. And now 15 years we are running this company, Dr. Vasisht Sai Remedies, along with my wife, Dr. Brij Balaji Vasisht. She is MD Ayurveda from IPGT and RA, Gujarat Ayurveda University, Jamnagar, Kachkissa. Why I tell you all this is because after spending a lifetime in all these activities, today I regard myself as a student of Ayurveda. So one life is not sufficient to learn and practice Ayurveda. And it's really difficult to, you know, to claim that one is an expert of some science, but even then we have to do it because if we spend a lifetime in a field, of course, we deserve to actually talk to our younger generation and convey whatever we learn all across. Okay. So this morning, friends, we shall be talking about Ayurvedic cardiology. And long back, I stopped delivering lectures. So this will be a heart-to-heart talk with you. And whatever I speak, it shall be available to you very soon in the form of a PDF of a book that we have just published. It's an ebook, and you need not to note down anything. You simply go on learning because I'll be talking, and whatever I say should go straight into your heart. That is the focus. Okay, friends. As I was in BAMS, I had a cherished dream that I practice cardiology in Ayurveda, and this was something unheard of then. Nobody, thought about it that one can be a specialist in Ayurvedic cardiology. But fortunately, when I got admission in my MD in Kachkissa, BHU, I had the opportunity to work on ischemic heart disease, coronary artery disease, and my research drugs were Pushkarmul, Arjun, Pushkarmul, Goglu, and Brahmi. And today I can tell you with confidence that if you use these medicines or drugs judiciously, you can do a lot favor to your patients. But at the outset, I like to make some, statements. The first statement is, whatever I speak, more than 60% of that credit goes to my wife and, my colleague, Dr. Brij Balaji Vasisht, who has been working all along with me for the last many decades. And then the credit goes to ancient Ayurveda acharyas and scientists who have been working in this field for the last more than 150 years. So only an iota of me goes to, of it, whatever I say goes to me. That I want to make the statement. And the second statement I want to make is treating or managing, cardiovascular diseases through Ayurveda is not a rocket technology. Why people are fearsome of cardiology or cardiovascular diseases is perhaps they are afraid of the emergencies. And I tell you frankly, friends, I ask you a question. What do you think? How many heart disease patients could be there in India? We have a population of more than 140 crores. So what do you think? Not more than 10%. I mean, if at the most, if the patients are there, 10%, 14 crore of people may be suffering from heart disease. And now the second question is, how many of those 14 crores you think are in the intensive coronary care units or ICUs for treatment? Very few, a small fraction. So the statement is, when it comes to treating cardiovascular diseases, 99% of the treatment is actually chronic management of diseases, and you need not fear about the emergencies. I don't say that you don't treat emergencies. If you have a well-equipped clinic or a center or a hospital, obviously you can treat. But if you don't have the facilities, even then, you can manage 99% of the patients suffering from cardiovascular disorders in your clinic because they need only chronic management. Okay. Now, my effort shall be to create a map in your minds, so that you can develop a frame of reference, and then you know you proceed to manage diseases through Ayurveda. What I mean is, I have a question for you. What do you think? Does Is heart or cardiovascular system different from other organs or tissues? I don't think so, because other systems and tissues are made of, organs are made of all those tissues: muscular tissue, then obviously nervous tissue, epithelial tissue, then connective tissue, all that. So whatever is there in other organs and systems is there in the heart. So that means whatever problems, whatever abnormalities are there in other organs and systems are bound to be there in the heart. But the only difference is, because heart is a vital organ, so obviously we have to be careful, because the course and prognosis of diseases in this organ could be different. So I simply draw a parallels between other organs and the heart. For example, you have inflammation in other organs. You have inflammation in joints, you have inflammation in skin, you have inflammation in liver, in nerves, wherever. Similarly, you have inflammation in the heart. And that is, if the whole of the heart is inflamed, it is called carditis, which is not very common. But if the inflammation is in the endocardium, it is called endocarditis. You may have patients of endocarditis. Why I'm drawing a parallels between other organs and the heart is because whatever principles you apply for managing diseases of other organs, all those principles are applicable while treating or managing the heart diseases as well. So, for example, if the inflammation is there in the muscle layer of the heart, it is called myocarditis. You have, you can have, myositis in other places. So in the case of heart, it is called myocarditis. If the inflammation is there in the pericardium, the fibrous sac, that is pericarditis. So obviously, whatever happens in other organs is happening in the heart. So again, but you need to know certain aspects of heart which are not there in other organs. And one of the aspect is Heart has to work 24 hours, 24 into 7. Without any break. You simply cannot afford to have a break in the working of your heart. So that is the major difference. Then obviously, many other processes are there that you need to take care of. So we will be discussing all those. But before that, I will like to tell you, suppose you are sitting in your clinic, in a hospital, in OPD, and a patient comes to you. And the patient complains that, doctor, these days I feel breathless as I climb the stairs or as I walk along some distance, particularly some uphill path. So what most of the times, in majority of the cases, what condition or organ will come in your mind? And we discussed it with many Ayurveda doctors. Unfortunately, most of them, I tell you, uh, unfortunately, most of the doctors, including some students, they attributed this breathlessness with the lungs. Probably the patient has stomach shwas or bronchial asthma. Now that is an unfortunate situation. As a physician, or as a cardiologist, you need to keep in your mind that if ever a patient complains of breathlessness, it needs to be attributed to the heart. There may be something wrong with your heart. So what I'm trying to impress upon you is the history of the patient. And then you need to interpret the symptoms in the light of the knowledge that you have about our other systems also. But in this case, for example, somebody says that he or she has cough. Obviously, you will think of lungs. You forget that it could be because of pulmonary edema. It could be because of left ventricular failure. For example, if somebody has got, edema, or there is swelling in the ankles or the lower limbs, so most of the times people attribute it to some other organs, to liver, to it could be, they are in the kidneys, but possibly it could be in the heart. They may think of it, but later on, you need to tell yourself that edema or shorter could be because of the heart. So what you need to do is stay aware of the complaints of the patient. Some patient tells you that I feel tired, fatigue is there. So most of the times what doctors do is immediately, without giving a thought, they will start prescribing medicines, particularly rasayana medicines, I mean the tonics. That is not the right approach. Go deep into the problem and then try to know what is that which is exactly causing fatigue or tiredness in this patient. So superficial knowledge will not do. You will have to dive down, know more and more about things, and only then you can treat in the right way. So history, as I told you, is important. Symptoms that could be attributed to other organs actually may be arising from the heart. For example, somebody, I still know, I keep on talking to doctors, and they use the word pain in the chest in coronary artery disease or angina. Frankly speaking, pain in chest is very rare. It happens in acute myocardial infarction. It happens, which has been described as Krumage Hridroga in Ayurveda. But frankly speaking, in most of the patients having angina, it is not pain, it is heaviness, it is tightness in the chest. And then what they assume is this pain or heaviness has to be on the left side. No, it is behind the sternum. So you need to, stay very clear about the presentation of the diseases, of the symptoms, and then you attribute those symptoms to various diseases happening in the heart. Now, the other thing is how to diagnose. Obviously, we still lack the enough facilities to diagnose cardiovascular diseases, but fortunately, these diagnostic facilities are available outside in the private market. You can refer your patients, you can get the investigations done, and then you can diagnose simply. So what you exactly need is, you need to be expert or skilled in getting the proper history of the patients, one. Then physical examination of the patient, particularly the heart of the heart. As students, you might be quite interested to know about the diagnosis about the murmurs, but practically speaking, when it comes to the management, you will realize that murmurs play a very short role, very small part. You know why? Because in many patients having murmurs, which are due to valvular heart diseases, medical treatment may be required, drug management could be required, but ultimately it is the surgery that is actually needed. So something may sound to be very interesting while you are a student, but when it comes to practically managing the patients, that thing may not be remain that important. So all these things I'm telling you, because it's, as I told you, it's not a lecture, it's just a heart to heart talk. So I'm telling you the salient things when you enter in your clinic or OPD, what challenges are waiting for you there so far as heart disease is concerned. So challenge is, you need to diagnose the disease in the right way. You need to know what is the abnormality and where is the abnormality. That's very important. What is the abnormality? I mean, whether it is inflammation in the heart, or there is certain type of blockage in the coronary arteries, or there is some conduction defect somewhere in the heart, or the pumping capacity of the heart has gone down. Likewise, so in this talk, I shall be confining myself to the conditions where you can really contribute a lot, in the field of Ayurvedic cardiology. And I'll name the conditions that I intend to discuss about. The first condition will be coronary artery disease. Coronary artery disease, ischemic heart disease, CAD or ISD. When the problem lies in the coronary arteries and the patient has either angina or unstable angina or acute coronary syndrome or acute MI. So coronary artery disease we shall be discussing. Then blood pressure disorders. Blood pressure disorders. I'm not talking about only about hypertension. What about hypotension? What to do about it? So we shall be discussing blood pressure disorders. Thereafter, heart failure, very important. Heart failure. And after that, we shall be discussing about arrhythmias, carditis, and if the time remains, we will discuss about the cardiomyopathies. Let us start with the coronary artery disease. So friends, according to surveys, about 6 to 10% of people in India, they have coronary artery disease. And as I told you, not all the patients are there in ICU. Not all the patients are there. Most of the patients are doing well with whatever treatment they are getting as chronic management. So you must know your limitations, but you must know about the possibilities, about the things that you can do. So in chronic management of coronary artery disease, you have a lot to contribute. The only thing is, you must know what exactly you are doing. You must know what needs to be done. That's very important. You must know this. Okay. Coronary artery disease will present in most of the cases with angina, and angina, as I told you at the outset, is heaviness in the chest. Heaviness in the chest. And this heaviness is more in the retrosternal area, I mean behind the sternum. And it is heaviness. It could be tightness. In very few patients, it could be actually frank pain. Otherwise, it is tightness. And then there is the pain can, radiate to other parts of the chest, back, neck, jaws, everything. So mostly this pain is because this pain, in most of the times, this pain is because there is blockage inside the arteries in most of the times. And this blockage, when the blockage is there inside the arteries, obviously when that person exerts physically, or sometimes he gets emotional or exposed to certain stressful situations, for example in extreme colds or in stressful situations, sometimes psychological stress is there, obviously the heart has to work more, its need for the blood increases, and the blocked arteries, clogged arteries, they fail to supply the required quantity of blood, and obviously a state of ischemia, lack of oxygen in a particular area of the heart develops, and it manifests in the form of heaviness in the chest. So in most of the cases, this is the situation. But there are patients who have heaviness in the chest, which is unrelated to any sort of physical exertion or emotional stress. Why is it so? Because in such a situation, the actual, the actual, the abnormality, the actual abnormality is not the blockage, but it is the spasm in the coronary arteries. Sankocha. Sankoch is there, and you know it. Sankoch is the karma of Vayu. So patients do have blockage in the arteries, coronary arteries, and obviously this is what is called Kafaj Hridroga. But at the same time, and most of the patients have Kafaj Hridroga, but in a small percentage of proportion of patients, they have angina because there is spasm inside the arteries. And then there is a third group of patients having angina. And medical science has started, having interest in this third pathology over the last about 10 or 15 years. Now, the latest development is probably there is inflammation inside the coronary arteries, which is responsible for the angina as well as acute myocardial infarctions. I mean, Krumage Hridroga in most of the patients. So now you have a patient who says that, doctor, I have heaviness in the chest. Obviously, you'll think of some blockage inside the coronary arteries, as if something heavy has been kept on the chest. And obviously, you will think of blockage inside the arteries. But at the same time, remember, even despite or in spite of the presence of blockage, sometimes the patient doesn't have the symptoms. And the same patient may get symptoms because of super added coronary vasospasm. That means a patient having blockage inside the coronary artery can have spasm in the coronary arteries because of what? And it's a peculiar situation. So you need to treat this condition as well. And the third abnormality or pathology that I just discussed was, inflammation. So most of the times you will be told that you need to use medicines that, to reduce the blockage inside the arteries. Yes, that is there. That has to be there. That is the approach of Ayurveda while treating Kafaj Hridroga. But at the same time, because you are an Ayurveda doctor, you know lot many things that science has yet So don't ignore the importance of Vayu. Don't ignore the importance of Pitta that causes inflammation inside the arteries. So now you have Vat, Kapha Hridrog when there is blockage inside the arteries. You have Vatic Hridrog when there is coronary vasospasm. And you have inflammation inside the arteries when that is resulting, that is Pitta Hridrog. Okay. And the treatment has to be obviously planned that way. Now, when it comes to treating these patients, what will you do? What approach, what protocol you should follow? Obviously, you will use some medicines that reduce the blockage inside the coronary arteries. First thing that you will do is, because that is the basic thing, and a lot of hue and cry has been made for the last many decades about the role of cholesterol and triglycerides. But at the same time, what about the patients who have heart attacks, acute myocardial infarctions, but whose cholesterol and triglycerides are normal, who are not overweight? So obviously now, because you are young guys, you have to start your professional careers. So I am putting forth in front of you challenges. You may be called to treat a patient who has normal cholesterol, normal triglycerides, and there is absolutely no blockage anywhere in the coronary arteries, but even the patient had acute myocardial infarction. So in that case, you need to keep in your mind that there are other factors as well in addition to the blockage inside the coronary arteries. I think uh, the matter is clear. Now, we will proceed accordingly. Because if the blockage is there in most of the patients, the cholesterol is high, the triglycerides are high, and what happens? Some sort of injury in the coronary endothelium. The lining inside the coronary arteries, endothelium. Some sort of injury takes place there. And what happens? Cholesterol and triglycerides, there in the blood, they simply sneak underneath the endothelium, and they start building up. They start accumulating, collecting there beneath the endothelium. And over time, what happens? Over time, oxidation of, there are free radicals in the body, and those free radicals, they result in oxidation of that cholesterol, that fat which is lying there beneath the endothelium, and that oxidized cholesterol is actually dangerous. It invites many macrophages. It invites monocytes from the blood, and then those monocytes, they engulf the fat, the cholesterol, and this is how the whole buildup starts, and ultimately a plaque formation takes place, atheroma. Or this is the process of atherosclerosis, which has been called as dhamni pratichaya. It's a Kafaj rog. So dhamni pratichaya takes place inside the coronary arteries, inside the heart. Blockage is there. So in that case, dhamni, this process is called atherogenic or atheroma formation. So what you need to do in such patients, you will have to use certain tikshna medicines, maybe ushna medicines that act deeply, that go deep down, and they act on it. So obviously, these medicines will be lowering the raised blood cholesterol and triglycerides, particularly the LDL cholesterol I'm talking about, not about HDL. HDL is good cholesterol. But if the cholesterol that has gone up is low density lipoprotein cholesterol, obviously you need to lower it down. But what medicine you will use for it? And that's what I'm here before you. The first medicine that should come in your mind is Gugulu, Komifora Mukam. And I'm fortunate I am fortunate to work under a great professor and physician of Ayurveda at BHU, late Professor S.N. Tripathi ji, my Guruji, who was the pioneer in working on Guglu as early as 1966, when he proved that Guglu acts by stimulating the thyroid hormones, the thyroid functions, it increases T3, T4 levels, it enhances or stimulates lipid metabolism, it lowers raised cholesterol and triglycerides, and then he proved it experimentally that atheroma formation or the atherosclerosis could be reversed by the use of Guglu. But there is a condition. You will have to use Guglu in the dose of 3 grams 3 times a day. Now you tell me, I don't know how many of you are aware of it, but usually I have seen people prescribing Guglu in the dose of 250 milligram twice a day, 500 milligram in a day. I don't know what the hell they are doing, what the hell they are up to. Because 250 milligram twice a day Guglu cannot work. So obviously, if you need anti-atherogenic activity of Guglu, you will have to use it in a higher dose, obviously 1 to 3 grams 3 times a day. So that's the observation. Okay. Now, after Guglu, you have one more medicine that many Ayurveda doctors are very afraid of, quite afraid of. And that medicine is Bhallataka, Semicarpus anacardium. Bhallataka is an Amrita described by Acharyas. Amrita. And then there is a section of Ayurveda doctors who are out to defame this medicine, this great medicine. I don't know if you asked me that don't use Bhalataka in your practice, I don't know how I'm going to practice. The things that Bhalataka does, who else is going to do it? So Bhalataka is a great medicine and it is anti-atherogenic. One more medicine I'll tell you, and that is Chitraka, Plumbago zelanica, Chitrak mool. Again, it's Tikshna, it's Ushna, Medohar, and one of its synonyms it's Agni. So obviously, it stimulates lipid metabolism, and in every patient of, you will be very fortunate when patients diagnosed by DM cardiology will come to you for treatment, because they don't want bypass surgeries, they don't want angioplastics. So in that case, I told you, managing heart diseases is not a rocket technology. It's all about your knowledge about the disease. It's all about your skill that you develop over time while managing it. And it's all about your confidence that you have in your science and in yourself, and the courage. Unfortunately, we have many fearful Ayurveda doctors. I don't want to use the word coward. That has a negative connotation, but they're so afraid of. They're so afraid of heart disease, about the medicines or drugs that we use to manage heart disease. So only God can save them. So friends, I told you 3 medicines: Guglu, Bhallataka, and Chitraka. Now you can ask me, and I'm not here to market about my products, but I have to cite instances, tell you the examples, so that you believe that whatever I am preaching, we are practicing as well. So I told you Guglu, Pushkar Moola, and Brahmi were my research drugs during my MD and PhD. And same Guglu we have used. Along with that, we have added 2 more medicines, Bhallataka and Chitraka, and we have manufactured one tablet which is called Rev Plaque, REVPLAQ. It reverses the plaque. And the dose has to be optimal. I mean, 2 tablets 3 times a day. Don't use it 1 tablet twice a day. And you don't use it. Because using medicines in subtherapeutic doses, in smaller doses, minuscule doses, is one of the reasons of failure of Ayurvedic treatment. So instead of using so many medicines in a particular disease condition, better use only 1 or 2 medicines, but obviously in therapeutically effective doses. That is the message I want to convey to you. That's what we have been practicing all along. So you have the choice. If you have Goglu in your clinic, use it in the dose of 3 grams or at least 1 to 3 grams. In some patients, you can use it in the dose of 1 gram. If you have Bhallataka, use its churna again, but it has to be 1 or 2 grams. We give it in the dose of 3 grams as well. And then Chitraka, obviously 1 gram of it to be used in the form of churna, or you can use a Replap tablet. So that is one thing for the blockage inside the arteries. Fortunately, there is one more medicine which is quite effective, which is really effective when it comes to managing, coronary artery blockages or blockages inside the arteries anywhere, be it carotid arteries or cerebral arteries or renal arteries or retinal arteries. Wherever there is atherosclerosis, you use all these 3 that I've just told you, plus one more medicine, and that is Jyotishmati. Silastris paniculatus, great medicine. It lowers the elevated blood cholesterol and triglycerides, and it does so many other anti-atherogenic activities, quite effective. So whenever you have sometimes you will see that some of your patients, they have associated underlying depression, and this depression is very obvious when patients undergo bypass surgery. Somehow the patients develop a lot of depression. Now, if in such patients, when such patients come to you for treatment, if in addition to the 3 medicines that you can use in therapeutically for the prevention as well as management, if along with those medicines you use Jyotishmati, obviously you will be managing the depression part of the patient as well. So friends, these were the 4 important medicines. One more medicine is there, quite effective, and that is Kataki, Picorrhiza Kuru. And you have a wonderful preparation in Ayurveda by the name Arogyavati. Make use of it. Make use, but again, be sure that you use it in its optimal dose, therapeutically effective dose. So I told you whenever a patient with coronary artery disease comes to you, make sure that you use these anti-atherogenic medicines. And you will see all these medicines and their description in the PDF that you are going to get. Okay. Now the second group is, as I told you, lately modern medicine has realized that the inflammation inside the arteries plays a major role in the initiation and in the promotion of coronary artery disease as well as its activation. That means if somebody has developed coronary artery disease, one of the initiating abnormalities could be inflammation inside the arteries. The patient was fine, he was a normal person, then somehow the artery got inflamed, particularly the endothelium, and the whole process of atherogenesis took place. So obviously, now this is something new. You won't find many doctors. You won't find many doctors who will be telling you this thing that I'm going to tell you. But you will see in your lifetimes that it is in the budding state right now. The use of anti-inflammatory medicines, for the management of coronary artery disease is something news to many doctors, particularly senior doctors. But in your lifetimes, you will see that yes, this is a major factor. So whatever anti-inflammatory medicines you have got, simple ordinary medicines I'm talking about, keep in your mind that sometimes you must use those medicines in case of coronary artery disease. That's important. And what are those medicines? I'll just name a few. As I told you, Guglu, it has the benefit of being anti-atherogenic, hypocholesterolemic agent, or lipid lowering or anti-dyslipidemic, but at the same time, it's anti-inflammatory. So Guglu has plays its role in many ways. So if you use Guglu, then obviously tell yourself, yes, I'm not giving something only anti-atherogenic. I'm giving the patient something. I'm trying to address that problem too of inflammation, which is anti-inflammatory. And another medicine, now I come to the actual anti-inflammatory that you might be knowing. Shallaki, can you think? Shallaki, Boswellia serrata be used in cases of coronary artery disease. But friends, it's true. Many of the doctors now, when we discuss with them, when they start using anti-inflammatory medicines, they get excellent improvement in their coronary artery disease patients. So Shallaki, then one more medicine, very effective. You might have heard about it, but you might not have used it. That Arundamula. No, whole world, runs after Arundatel, castor oil. Yes, it's effective, but at the same time, in my opinion, it's a blunder not to use the root or the skin of the root of the bark of the root of Arundamul or Arunda, plant. So Arundamul is highly effective as an anti-inflammatory. And then I'll tell you about one more medicine, very effective anti-inflammatory, and that is Bilva Patra, Eagle Marvelous. Eagle Marvelous leaves I'm talking about, not about the fruit. So quite effective. So all these medicines, all these drugs you can use as single drugs or in combination, in whatever form you use, but make sure that you use them in the optical or therapeutically effective dose. What do I mean by that? For example, you use Arundamul Churna. Obviously, it has to be used in at least 3 grams per dose, twice or thrice a day, or you can use extract of it, ghana of it. So instead of using 3 grams, you can use just 600 milligrams of extract, and that's all. So irrespective whether you use churna of it or ghana of it, make sure that the patient gets the optimal dose of a drug, whatever you use. That's very important. Now, friends, I'll name a few other anti-inflammatory medicines that are quite effective, though they are secondary, not primary. And one of the medicines is Madhyashti. You might be knowing a lot about Madhyashti, but most of the people think that it is an expectorant. Yes. It is ulcer healing. Yes. It is antacid. Yes. But at the same time, Madhyashti, Glycyrrhiza glabra is a great anti-inflammatory medicine. So wherever the inflammation is, so now the difference between Madhyashti and the previous medicines that I talked about, Guglu and others, Arundamul and Bilva, the Madhyashti is a Shitavirya, but it is not Ushna. And can you imagine a Shitavirya medicine could be anti-inflammatory? Yes. And one good thing about Madhyashti, and it could be bad thing if you use it in heavy doses for extended periods. But one good thing about Madhyashti is it has natural steroids. So whenever You think of using steroids in your patients, think of Madhyashti. But again, it should be given in optimal doses and only for the required duration. That is all. And another anti-inflammatory medicine that you can use in heart disease patients is Goduchi, Tinospora cardifolia. There are quite a few others also. There is Tulasi, Punarnava, Chopchini, many others. You'll get this information in the booklet that you're going to get. So friends, this is the second group of medicines that you need to use in coronary artery disease patients. I mean anti-inflammatory. And now I talk about the third group of medicines. And that is coronary vasodilator medicines. There are medicines, there are drugs who possess coronary vasodilatory effect. And one of the foremost medicine or drug that I tell you is none else than Pushkar Mula, my research drug. Pushkar Mula inula resinosa. I have worked, I've done clinical study and experimental study as well. I worked on frog heart. Experimentally, I saw that when Pushkar Mula is given to frog heart, it has three important pharmacological actions, and those actions have been given in my thesis also, MD thesis. One of the actions is it improves coronary blood supply. It acts like nitrates. It improves coronary blood supply. That is the foremost action. The second action is Pushkar Mula lowers the heart rate. If the heart of a person is, pumping at the rate of, say, 70 times per minute, if you use Pushkar Mula, you will see in your patients that the heart rate comes down. It could be anywhere between 70 and 60. And the third thing is Pushkar Mula lowers the force of contraction of the heart. That means it acts like beta blockers. It acts like beta blockers. It reduces the heart rate. It reduces the force of contraction of the cardiac musculature. And it acts like nitrates, and it dilates the coronary vessels. So see how kind the nature has been. Nature has produced, medicines, drugs, solutions to problems rather. Medicines are nothing but solution to the health problems. Nature knows that I will create asatma indriyartha sanyog prajna pradhan parinam. On the basis of this, the patients will develop coronary artery disease, and nature has produced Pushkar Mula. Now, if you don't use Pushkar Mula in coronary artery disease, it's not the fault of nature. It's your fault. So keep in your mind that whenever a patient comes to you, you have to use Pushkar Mula for giving instant relief in the symptoms that the patient has got. Because as I told you, coronary was a spasm, Vata. Vata is quick in actions, isn't it? Activities are, Vata are very quick. So the patient has got angina, and you use coronary artery vasodilator medicine, Pushkar Mula, in a few minutes, the patient will start getting relief. And this was proven by one of my seniors at BHU. He gave Pushkar Mula 2 grams or 3 grams to the patient, and he got the ECG done before giving it, and then serially he got the ECGs done after every half an hour, and the patient was subjected to stress test, and it was found that the patients who, before taking, before they were given this Pushkar Mula, they had ST depression. The signs of ischemia were there in the ECG, but as those patients received Pushkar Mula, the ST depression was less marked. It was not that much as it was without Pushkar Mula. So clinically, this was proven by one of my seniors, Dr. V.K. Gupta ji, and experimentally, I proved it on, frog heart, and clinically, I proved it in my patients. So Pushkar Mol is one drug that you must remember while while managing coronary artery disease. There are some two more medicines that you can bank upon for coronary vasodilator effect. One of the medicines is Duralabha, Fagonia arabica. Thamasa it is called in Hindi. So Duralabha, actually Duralabha is the drug of choice in Ayurveda for vertigo. Duralabha, Fagonia arabica. But at the same time, it is very effective as a vasodilator, I must tell you, because in cerebral, ischemia, the patients having transient ischemic attacks, if they are given Duralabha, they benefit a lot. And obviously, if you give it in your angina patients, obviously they show a lot of improvement in their symptoms. Because sometimes, I tell you how to do it. A patient, you might have heard about stable angina. Stable angina means there is a patient who tells that I climb stairs, say 2 flights, and thereafter I have to stop because I feel I get breathless and I have a tightness in my chest or heaviness in my chest. So that means after a fixed, quantity or fixed amount of exercise, physical activity, the patient is bound to have angina. Now what you do is, before the patient climbs the stairs, give therapeutically effective dose of the drug, for example, Pushkar Mol, or as I told you, Duralabha, or even the third one, Chop Chini. Chop Chini, you might have heard about Rakta Shodhak, So many doctors keep on prescribing Chop Chini as a Rakta Shodhak across their lifetimes. And Rakta Shodhak has so many meanings. It is anti-infective, yes, but at the same time, Rakta Shodhak means if a lot of armor or vasa or medodhatu has accumulated in the blood needs to be, needs to be cleared of all those things. So Chop Chini is anti-dyslipidemic, and at the same time, Chop Chini has been proven scientifically to have vasodilator effect. So you have 3 vasodilator medicines. Coronary vasodilator medicines I'm talking about. You have Pushkar Mol, you have Duralabha, and you have Chop Chini. Give it to the patient 10 to 15 minutes or say half an hour so that the medicine gets absorbed properly and it reaches the blood and of course the heart. And then ask the patient to go for the same amount of physical activity. For example, climbing stairs for 2 flights. Or if somebody tells you that I walk about say 500 yards and I get tightness in my chest. So ask the patient to walk the distance and you will be more than happy to find that your patient can perform more exercise than before. What more evidence one needs? And obviously those, that improvement will be reflected in the electrocardiogram. So this is something to celebrate. We have so many effective medicines. But the only thing is, you keep in your mind, if you use churnas, I mean powders, obviously it takes a lot of time for the bioactive compounds in those powders to, get separated from the fiber. There is a lot of fiber in the churnas. What is the difference between an extract and a churna? You might be, knowing many doctors, Ayurveda doctors, who say that we don't use the extracts. We are watery of using only churnas. What is the hindrance in using churnas? Bioactive compounds, alkaloids or flavonoids or whatever they are attached to the fiber. And it takes a lot of time for the bioactive compounds to separate from the fiber, and that is all That is what digestion is all about. Pachana is all about. So the medicine needs to be digested first. That means those bioactive compounds need to be separated from the fiber, and thereafter they will be absorbed from the gut mucosa, and then obviously they will reach blood circulation and reach the blood. And then you have another option. Instead of using, churnas, you use directly, straight away use the extracts. What will happen? There is no time spent for digestion or separation of bioactive compounds from the fiber. So a lot of time is saved. So there you ensure a fast absorption of the bioactive compounds reaching the blood circulation. So if you use, say you give 3 grams of pushkar mool to a patient and ask the patient to climb stairs after half an hour, instead you can use pushkar mool ghana and ask the patient to climb after 15 minutes, and you will see the difference. Now friends, let me conclude. Coronary artery disease, because blood supply is low, reduced in a certain part of the heart where there is some problem with the coronary artery, and I'm sure now onwards you will not hold guilty only the blockage inside the artery. Now you will keep in mind that there could be inflammation inside the artery, there could be spasm inside the artery, there is kapha, there is pitta, there is vata. So being an Ayurveda doctor, you need to have a holistic approach, and this is what holistic approach is all about. So now you need to give medicines for the blockage, anti-atherogenic. You need to use medicines for alleviating the inflammation inside the arteries, and you need to use some coronary vasodilator. That was the first group of medicines. And obviously you will see that you will think that the number of medicines will be more. It's not the case. Ultimately the number is quite limited and the patients can easily take it. Now there is the second group of medicines, and this group is like beta blockers, because the demand of oxygen by the cardiac muscle depends upon the level of activity it is subjected to go. For example, if you do something physically, if you do strenuous exercise, sometimes your heart may need 4 times more blood which it actually needs in resting time otherwise. So what happens if the art somehow, the concept of beta blocker says, don't let the heart beat too fast and too forcefully. That is the idea. That is the idea. You don't let the heart beat too fast. There must not be a lot of tachycardia. And the force of contraction, I mean the positive inotropic effect has not to be there. And that is what brought about the beta blockers. You have some medicines that act like beta blockers. And one medicine I told you, coronary vasodilator, pushkar mool, it acts like beta blockers. And I am the evidence of it because I've done the experiment with my own hands on frog heart, and there are graphs, that graphs are there where it is clearly seen that when we give pushkar mool, the heart rate comes down, the force of contraction of the heart muscle comes down. Now I'll tell you few more medicines that you can use to decrease the cardiac activity. One of the medicines is Jatamansi, Nardostachys jatamansi, and a lot of research has been done on it. And the other medicine is Shalaparni, Desmodium gangeticum, Shalaparni. And one of the synonyms of Shalaparni is Thira. My Guruji was very fond of it. I am really indebted to my Guruji, great Guruji, Professor Asan Tripathi ji. It's only because of him that I'm talking to you guys, this morning. he used to tell us that because one of the synonyms of Shalaparni is Thira, it stabilizes the activity of the heart. And you will be very glad to know that even scientific studies have proven this fact. So whenever there is tachycardia, use Shalaparni. Whenever there is tachycardia or more force of contraction of the heart, use Shalaparni or Jatamansi or Pushkar Mool, whatever. 3 medicines I told you. And I'll tell you 2 more medicines for this purpose also. They are secondary, not primary. Secondary means initially you have to use the primary medicines, and thereafter in maintenance doses for extended periods you can use the secondary medicines. And these medicines are Tagar and Vacha. Vacha, Acarus calamus. And Tagar is, Valeriana, Valeriana wallichii. Valeriana wallichii. So friends, now we have second group of medicines, and because Pushkar Mool you will be giving in the first group also. So it's a repetition. You simply know that you are using medicines which are acting both ways, as coronary vasodilators as well as lowering the cardiac activity. And the third group is very important. You all know it. That's very important. You never let the blood clot inside the arteries. Rakta Granthi formation, Rakta Granthi Nirmana, thrombus formation has to be avoided in all situations. And you can do a lot. You can do a lot to prevent clot formation. Antiplatelet or platelet aggregation inside the arteries. One class of medicines, Ayurvedic medicines, is there in your kitchen. All those spices, all the spices in your kitchen, they are antiplatelet. They are antithrombolytic. They don't allow the blood to clot easily. So ask your patient to consume as much spices, including red chili. Now I tell you about red chili. Red chili is a great medicine, but because world came to know about red chili only after Columbus landed in America, okay, in early 1600. So only after that, this red chili or capsicum frutescens that traveled across the world. And because it came to India in early 16th century or 17th century, I must say, it is not mentioned in Brahatrai or in ancient Ayurveda, texts. So that doesn't mean that it should not be used in treatment. So many of our medicines, one medicine is there, antithrombolytic thyrin that we use. We have added, this red chili in that. So all the spices are there in your kitchen. They act as antiplatelet agents. So increase the use or consumption of spices in food of your patients. And then among those spices, you are well aware, rasona, allium sativum is one. Allium sativum is a widely researched drug across the world. Antiplatelet, then anti-atherogenic, and whatnot. So make use of, and you can make use of it as powder or kalka or tablet of it. Gun tablet is there, but you can ask the patient to use it raw as a kalka along with the meals. There are certain more medicines that are used to, as antiplatelet or antithrombolytic medicines. And those are Bhallataka, that I refer to at the very outset. Bhallataka, Chitraka, again. Because these medicines have multi-actions. These are multi-dimensional medicines. So that is why they are being repeated in different groups. So it means that one medicine will work in many ways. Then Gandhira, I thought there is one more medicine, Gandhira. Gandhir is Coleus forscoli. Now, Coleus forscoli is a plant that contains forskolin, and this forskolin, this alkaloid is highly effective in many diseases, including heart disease. Particularly, it acts as thrombolytic agent, antiplatelets. You can make use of it. You will get description of all these medicines as you refer to the PDF that we have sent you. Friends, then there is non-drug treatment, lifestyle changes that you all know. Simply, we tell our patients of coronary artery disease to reduce the intake of sugar and limit the use of fats. And if the patient is hypertensive, obviously, we ask them to, cut back on salt, and thereafter they are asked to remain physically active, avoid mental stress as far as possible, have a 7 to 8 hours of sleep, and then avoid smoking if they do it, and meditation and pranayam, all that, this all comes under non-drug measures. And of course, there is one more group that you can make use, and that is the Rasayana group. I mean, antioxidants like ashwagandha, shilajit, yashad, amlaki, lavang, etc. These are. So when it comes to generating the prescription for the patient suffering from coronary artery disease, you need to take into consideration all these groups. Obviously, you will prescribe something that is anti-atherogenic, anti-inflammatory, and of course, coronary vasodilator. So if you use Guglu and Bhallataka and Chitraka, these medicines have multiple actions. So obviously, you can use this combination of Replac, and then what we did was Pushkar Mool. We added one more medicine. Arjuna. You might be waiting for the Arjuna. Yes, Arjuna is there. Arjuna improves the health of the endothelial tissues, and that increases the production of nitric oxide. And that nitric oxide, what it does is it dilates the coronary arteries. So it has to be used along with Pushkar Mool. So we have a combination that contains Pushkar Mool, Arjuna, and Brahmi. Brahmi again, it increases the microcirculation. And it comes in the name of Carflows tablet that we use. So simply giving 2 tablets, Replac and Carflows tablet, that's what we do. And in some patients, we do use some thyrin also as a thrombolytic agent. So that is all about coronary artery disease treatment. But we have given many options for you while managing coronary artery disease. So obviously, you can proceed like that. Okay. Now, the other disease that now, because coronary artery disease is a major disease, and you will get many patients across your lifetimes suffering from coronary artery disease. So I've just discussed this in detail, but in brief, I'll let you know about the high blood pressure. So there are medicines, blood pressure when it rises. Why does it rise? Why there is hypertension? Because there is some abnormality in Vyanavata. Vyanavata is the section of neuroendocrine system that regulates blood circulation. Okay. Now that section, that division of neuroendocrine system, it's a nervous system, but it regulates blood circulation and the pressure inside the arteries. But what makes the Vyan Vayu to become Prakopit and raise the blood pressure? Maybe Prana is a Dushta and it creates avaran of Vyan Vayu. Prana is Dushta. It creates avaran of Vyan Vayu and the blood pressure rises. How? The person has anxiety, depression, a lot of mental stress. It obviously stimulates the hypothalamic pituitary axis, and thereafter many hormones are made, and ultimately the blood pressure rises. So this is pranjanya, Vyana avaran. then there could be some problem in the hypothalamic pituitary axis. Udan Vayu directly. So that Udan Vayu hypothalamic pituitary system can affect the cardiovascular system and result in high blood pressure. And there could be Saman Vayu, thyroid, liver, other organs, pancreas, hormones related with metabolism. Some defect in metabolism could affect the cardiovascular system and result in high blood pressure. And there could be Apan Vayu. The division of the nervous system and endocrine system that regulates the excretion, including kidneys. So there could be some defect in there, and that may result in cardiovascular disturbances, including high blood pressure. So ultimately, what you need to do is use medicines that regulate or harmonize the cognitive functions, I mean higher centers. Pranavayu, like you use Brahmi, Jata, Shankapushpi, and Manduparni, or use medicines to harmonize the hypothalamic pituitary system, I mean Udan Vayu. There are medicines like Jata Mansi, Ashwagandha, Sarpagandha. Then you use medicines for your hormones, metabolic hormones like thyroid, liver and pancreas. Use medicines like your medicines like Bhumi Amalki. Bhumi Amalki is there, Guduchi is there, Bhrungraj is there. Then there are medicines that act directly on the cardiovascular system, Vyanvayu. You have Pushkar Mool, Tagar and Harmal. And thereafter you can use medicines that act on excretory system, like Pundarnava is there, Bhumi Amalki, Sahadevi is there. So you have many options while managing high blood pressure. One medicine from each group is enough to offer the effective treatment against high blood pressure. So what we did was we selected one medicine from that is acting against the pran dushti, Shankhapushpi, one medicine for Udan Vayu, hypothalamic pituitary axis, and that is Jatamansi, one medicine for thyroid hormones and other hormones that regulate metabolism, and that is Bhumi Amalki, one medicine for excretion, that is Pundanava, and one medicine Sarpagandha directly for the heart. We combined all these 5 medicines, created one Samvyan tablet, and that is the ideal medicine for the treatment of high blood pressure. See, we have a lot to offer to the high blood pressure patients, because you know the fact that modern medicine says that in 90 to 95% of the patients, the underlying cause of hypertension is not known. That is why they call it as essential hypertension or primary hypertension. But in Ayurveda, you can explain high blood pressure through your 5 divisions of what? Through your Avaran concept, by using medicines that act at different levels, and obviously that can result in better control of blood pressure. Now, I will say a few words about hypotension. For example, a patient develops hypotension, know the cause, whether it is some sort of psychogenic shock or neurogenic shock, or there is some septicemia, or there is blood loss, there is dehydration. So many factors could be there. And you need to use medicines to elevate the blood pressure in hypotension. I'll tell you some medicines that directly act on the blood vessels. They result in vasoconstriction systemically, across the body, and raise the blood pressure. One of the medicines highly effective is Karpura, camphor, Cinnamomum camphora. Then one more medicine is there. You might have heard about Kasturi, which is not being used these days. But we have a medicine named as Lata Kasturi, quite effective. It is imported from other countries, especially Thailand, Malaysia. But it is effective. It smells like, its fragrance is like Kasturi. Then Hingu, Ferula fetida. Hingu Karpur Vati is one of the preparations widely used by Vaidyas for the for increasing the low blood pressure, Hingu Karpurvati. But that contained kasturi, and that kasturi is no longer available. So Hingu Karpurvati without kasturi you can use. And of course, Suvarna. Suvarna, gold in the form of Makara Bhaja, Brith Kasturi, Bhairav Rasa, Mahalakshmi Vilas Rasa you can use. So all these medicines work to increase the low blood pressure. And one of the medicines is Dhatura, Dhatura alba. It is used in Sooth Shakra Ras. It is used in Mahalakshmi Vilas Ras. It is anticholinergic and it is actually parasympathetic. So it increases sympathetic tone and blood pressure. Then some more medicines are there that you can use for in the management of peripheral shock, peripheral circulatory, to increase the peripheral circulatory tone. And coffee you can use for this. It is cardiac stimulant. And if the blood volume has gone down, if there is dehydration, of course you have to replenish the lost body fluids by electrolytes, water balance. We have a product by the name Amritoj that we use in this. And if there is blood loss, of course you need to use, a transfusion of blood. So friends, this was all. I think we have crossed the how much time remains? Can anybody tell me?
Sir, 15 minutes.
Yeah,
Sir, 15 minutes to 20 minutes. You can take.
15 minutes. Okay, I'll cover, a very important topic is their heart failure. So in 15 minutes, I'll try to complete it. Friends, you will be getting lot many patients suffering from heart failure. Lot many patients. But there you have to decide what is actually causing the heart failure. Is it something which is within the intrinsic in the heart, some abnormality in the heart itself, like the muscle has become weak, or it is inflamed, or there is some problem in the valves, there is a valvular heart disease, or some cardiomyopathy sort of thing is there, or some area of the heart has become dead, myocardial infarction. So, some problem within the heart can result in heart failure. But sometimes, if the heart has to work against a greater force, for example, if there is systemic hypertension, if the arterial hypertension is there, if the patient has high blood pressure, of course, the left ventricle has to function against that raised blood pressure. So the heart has to pump with greater force. And a time will come when the heart will get tired. And sometimes there is the blood volume goes up. For example, there is some problem in the kidneys, or sometimes there is, hypothyroidism is there. A lot of body fluid accumulates. So in that case, what you need to do is you need to reduce the quantity of the fluid inside the body. I mean, you need to use some Kleidhar medicines. Now let us talk about the medicines that you can use in managing heart failure. The medicines that can increase the force of contraction of the heart. Of course, when I say this, one medicine that comes in your mind is Arjuna. Yes, but there is one more medicine that should be thought over before Arjuna, and that is Vanapalandu. Vanapalandu, Arginia indica. It's a cardiac glycoside. It acts like digitalis. So what it does is, in heart failure, what happens? These actin and myosin fibers, they become so relaxed. So the function, the action of digitalis or Arginia indica or Vanapalandu is the actin and myosin, they are brought within the range so that they start contracting in a better way. So that is the mode of action of Arginia indica. So Vanapalandu you must use. Then of course Arjuna is there, and one more medicine that is required to increase the force of contraction of the heart is Gandir oleus foscoli. These are the three medicines that are primary, positive inotropic medicines. Then there are certain more medicines like Akik, Pishter, Akik Bhasma is there, Zahar Mora is there, then some calcium, salts are there, mukta, pishti, praval, etc. So this group is used to increase the force of contraction of the heart. But at the same time, if you find that the afterload on the heart is more, I mean, if the blood pressure is high, obviously you will need to use antihypertensive medicines that we have already discussed. And if you find that the blood volume has gone up, as it happens in renal failure or in beriberi or in hypothyroidism sometimes. So in that case, you need to use medicine that have a diuretic effect. So how to use, what are the medicines? Obviously, Pundanava is one. It tops the list. But at the same time, don't forget to use Bhumiamalki. Bhumiamalki is Phyllanthus neruri. And it stimulates urine formation, excretion of extra fluid inside the body. It is excreted through urine. Then there is one more medicine, Sahadevi, Vernonia cinerea, very effective Mutrala, and Kakmachi is there. Kakmachi is Solanum nigram. It is widely used as Arka Mukoe or Mukoe Arka or Kakmachi Arka. And of course, Gokshar is there as a diuretic. So whenever there is heart failure, use medicines, one group of medicines that increases the force of contraction of the heart. The other group is that decreases the high blood pressure if it is there. And the third group is diuretic medicines that excrete extra fluid collected inside the body, and otherwise there is a lot of preload on the heart. So friends, this is about the heart failure, the basic medicines that you need to use. And thereafter I come to another situation, arrhythmias. Sometimes you may get patients who have arrhythmias, and arrhythmias could be tachyarrhythmias and bradyarrhythmias, means the rhythm of the heart is disturbed. The rhythm is no longer there and there is irregular heartbeat. There could be irregular heartbeat, but at the same time the heart rate could be high. It is called tachyarrhythmia. There could be irregular heartbeat and the heart rate could be low. It is called bradyarrhythmia. Now, what is the difference? If the heart rate is beyond 100, it is tachyarrhythmia. If it is below 60, it is bradyarrhythmia. Now, what are the medicines that you can use in tachyarrhythmias? It is found in atrial fibrillation, atrial flutter, sometimes, in paroxysmal supraventricular tachycardia. And I tell you, you will be getting many patients suffering from PSVT. I mean, paroxysmal supraventricular tachycardia. And in such cases, you can use medicines that regulate the activity of the heart contraction. And I told you, Pushkar Mool acts like a beta blocker. The first medicine that should come in your mind is Pushkar Mool. And of course, one more medicine that we discussed was Shalaparni, Desmodium gangeticum, and then Jatamansi, Vacha, and one very important medicine is Gojiva or Gavjava, and its botanical name is Onosma bracteatum. So this is a list of medicines, and you are not supposed to prescribe all the medicine. Just pick up one and prescribe in full therapeutic dose. That's all you need to do. And for example, if a patient comes to you in this PSVT, paroxysmal supraventricular tachycardia, so in that case, what you can do is just give 2 grams of Godanti Bhasma. Ask the patient to keep it below the tongue and just go on sucking it. Don't swallow it, and you will see that sometimes within 5 to 7 minutes, the heart rate comes within normal limits. And of course, sometimes you need to use some other medicines, obviously, that we have discussed. For long-term management, I'm telling you something that can act fast, promptly, and bring down the raised heart rate, and sometimes it goes beyond 150, 200, and even more. And then bradyarrhythmias. Sometimes the problem arises. Bradyarrhythmias is there. That means the heart rate is below 60. And if it is there, many a time doctors, cardiologists, modern cardiologists, they advise or prescribe implantation of pacemaker. Yes, it is required, but sometimes you can try certain medicines, and I'll suggest you a few. As I told you, medicines that could increase the blood pressure: Karpur, cinnamon camphora, Lata Kasturi, and Hingu, and Suvarn and coffee. Particularly, you can use Lata Kasturi and Karpura. And in certain cases, you can use, Parsik Yavani as well. So friends, these are the medicines. And then, of course, you will be required to manage the underlying abnormality. Friends, then comes another very important medicine disease, and that is carditis. And in this case, we will discuss only endocarditis. And endocarditis is a condition when a patient comes to you with fever. The patient is weak, has fever, and there is associated murmur in his heart. The diagnosis clinically is endocarditis. Vegetations form inside the valves inside on the endocardium, and those vegetations, they can get detached, they can lodge in some other organs, particularly the brain, and result in stroke. And that is the significance. So obviously, in most of the patients, the endocarditis is because of bacterial infection, and you need high doses of some antibacterial medicines, or these antibiotics. So heavy doses are given in good centers of allopathy. But if some patients are interested to have your treatment in endocarditis, of course we can suggest some medicines. We have Ativisha. Ativisha is Aconitum heterophyllum, or Chiraita, Swarsha chirata, or if you can use Malla. Malla is arsenic in the form of Samir Panagras or Malla Sindur. So that is, these medicines are used as antibacterial. And because there is a lot of oxidative stress in these patients, free radicals are there, they are damaging the heart. Obviously, you need to use some Rasayana medicines, and the best Rasayana medicines are 4: Ashwagandha, Shilajit, Amlaki, and Yasha. Friends, we can leave the rest. And finally, cardiomyopathies, you can give only symptomatic treatment. If there is myocarditis, if the heart failure is there, obviously you can use medicines used in the case of heart failure. If there are tachyarrhythmias, obviously you can use medicines used in that condition. So friends, that was all about the Ayurvedic cardiology from a clinical viewpoint. I try to wade through this and create an impression in your mind about what is Ayurvedic cardiology and how you can go about it. If you have any queries, you can ask me. I know many things may not be very clear because I dealt with these things in a brief way. That was because of the paucity of time. So we may look forward for another meeting where we can discuss the things that have been left. So thank you very much, everyone, especially the organizers who gave me an opportunity to be with you, and to you all to spare your valuable time in listening me. Thank you very much.
So sure, sir. Thank you so much, sir.
Thank you.
The session was very, very informative. and it gave a new dimension to Ayurvedic cardiology. So the highlights of your talk, sir, you have told that one life is not sufficient to learn the Ayurveda. Is exactly true, sir. And it was a heart-to-heart session, heart-to-heart talk. And sir mentioned mainly the Rogamado Parishitato Anantara Mokshitam.
Your
The
voice is not audible to me somehow. I'm
okay,
listening,
sir.
but it is very low.
Okay, sir. We stressed on the diagnosis, sir. Firstly, so Rogamado Parishet Tato Anantara Mokshitam. So first diagnosis
Obviously.
should be the proper, then only the treatment. In the treatment also you have mentioned, sir, the optimal dosage and the selection of drugs. That is the group of drugs we have mentioned. Any question answer sessions? Sir, one question, sir. Sir, am I audible, sir?
Yeah.
Sir, role of cardiac risk markers investigation like HS, CRP, apolipoprotein, etc. in diagnosing cardiac diseases.
You're not audible fully. Can you send your question in the chat box if it is there?
Sir, it's in the chat box only, sir.
Okay. Pardon. You repeat the question?
Role of cardiac risk markers.
Yeah.
Sir, role of cardiac markers. Investigations like
Role.
HS, CRP, apolipoproteins, etc. in diagnostic cardiac diseases.
Actually, I have deliberately omitted that part because diagnosis, although it is very important, it has to be there. But what actually lacks in Ayurveda is the 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 information about the medicines that could be that act on the targets. So my actually focus was on discussing things that we could use, discussing medicines that could be used after the diagnosis is made. So actually, role of these cardiac markers is a lot. Unless you know all these things, you cannot diagnose. But that will open up a new Pandora box. It will require a lot of detail. Then we can discuss the things. But they have to be there. Without the those diagnostic tools, it is not easy sometimes to make the right diagnosis.
Okay, sir. Sir, one more question.
Yeah.
Sir, what are the long-term complications of COVID-19 coming across in clinical practice till
Yeah.
date
Yeah.
and their
Yeah.
management in Ayurveda?
Yeah. Yeah. Long-term complications of uh, in the light of cardiovascular system we'll be discussing. COVID has done a great harm to the immune system of the people. So while the immune system gets disturbed, so there are chances that the immune system attacks body's own cells, and it acts like a autoimmune process. So autoimmune disorders would be there, and the worst thing that can happen is the cardiomyopathy. And if the cardiomyopathy is there, obviously the force of contraction of the heart goes down. But at the same time, if the cardiomyopathy is there, that can, trigger tachyarrhythmias. So sometimes, sometimes happens, people are dying because they develop tachyarrhythmias, and they ultimately land up in sudden death. So that is one of the worst complication with this. But we are seeing lot many patients of cardiomyopathies, both constrictive cardiomyopathy, restrictive and dilated cardiomyopathies after this corona. And obviously, the needle of suspicion, goes to coronavirus. So obviously, then there are chances of thromboembolic phenomena sometimes. So if the endothelium is involved, endocardium is involved, I mean, then of course there is thrombus formation and the thromboembolic phenomena can be there. So lot many complications are happening because of the coronavirus.
Thank you, sir. Sir, one more question. A
Yes.
consuming heart of a goat, can it become Hrudya? Consuming a heart of goat, can it become a Hrudya?
I cannot listen you.
Sir, consuming a heart of goat. So Aja Hrudaya can be considered as Hrudya Dravya.
I cannot make out what you're saying.
Sir, consuming heart of goat. Am I audible, sir?
Heart of
Goat, Aja.
goat, heart of goat.
Is a Hrudya. Somebody is asking, is it Hrudya?
Consuming heart of goat can
Become Hrudya.
I cannot make out.
Sir,
But
is
you
a
know,
Hrudya Dravya.
these things are a matter of a lot of research. Many things have been written, and unless proven otherwise, you cannot simply believe them. Of course, they need to be subjected to research first.
Hello. Sir, am I audible?
Yeah. Yes, please.
Sir, what are the possible interactions that single Ayurvedic drugs like Gugulu, Bhallataka may encounter with ongoing allopathic drugs in cardiac patients?
Yes.
Sir,
Very
drug
important.
interactions.
Very important. See, you have different approaches. I'm talking about the approaches that we followed all along. Many of the patients, we tell them that you continue with the treatment, whatever you're taking, and in addition, you start our own treatment. And then we go on assessing the results in every form. Particularly, we are concerned with the heart rate and the anticoagulant effect. For example, somebody is having antiplatelet medicines. What are the positive interactions that single Ayurvedic drugs like Gukulu Balatak and yes. Yeah. So, for example, a patient is already on antiplatelet medicines, and if you prescribe some antiplatelet like Raktamarich is there, or some other medicine, or even the Bhallatak has antiplatelet effect, of course, you will need to reduce the dose of allopathic anticoagulant or antiplatelet medicines. And so far as their effect as antidyslipidemic is concerned, so we don't subscribe to the viewpoint that patients should be taking statins too much. So instead of allowing the patients to take statins, we have more confidence on our medicines, Gugulu, Bhallatak, Chitrak, and Jyotishmati. So there is no need for them. But the question comes when the patient is taking beta blockers, and then we start using our Pushkar mode. In many patients, the heart rate comes down, and in those cases, we ask the patient to consult their doctor to lower the dose of their beta blockers. So interactions are always there, I tell you, because body is one, and the mode of action of many medicines is the same. So we need to be extremely careful while prescribing these medicines.
So next question is on your screen, sir.
See, again, I tell you, cardiac emergencies as such cannot be managed only through Ayurveda alone. That is my viewpoint. Somebody may have some other, experiences, but we have always made it a point to not to risk the life of the patient. And because sometimes the emergencies are such that even when the patient is there in the ICCU, cardiac arrhythmias can happen in a patient of acute myocardial infarction, and the patient can die at once. So we have already made it a point that unless it is not a risky thing, uh, the patient should be referred to a hospital, well-equipped hospital where the cardiac emergency could be managed. But smaller emergencies, I wish that we discuss these emergencies in another some other point. And there are lot many things that we can do. And as I told you, the patients who go in peripheral shock sometimes, even a very what you call ordinary medicine, Hingu Karpurpati, works a lot. And as I told you, if there is a PSVT, the heart rate of the patient is too high, sometimes it is more than 200. It is controlled by giving Godanti Bhasma alone. But again, we need to take a look of the cardiac medicines, emergencies in a better way, in a deep way, and discuss in detail whatever we can do. But again, I tell you, every emergency cannot be dealt with through Ayurveda. That is my viewpoint. Of course, Brahad Kasturi Bhairav has been there, but nowadays all these things, are not, easily available, and genuine medicines are not available. So that is another factor.
So next question is on the screen, sir.
Yeah, drugs, LED blockages anywhere in the body. What we need to do is, we do not claim that all the blockages are they simply removed. No, but we can do a lot to reduce the size of the blockages or the plaques, and ensure that the blood supply to the affected part of the heart is optimal. So whether you use Guglu or Bhallatak or Chitrak or Jyotishmati or some other medicines, over time you feel that the overall blood circulation to the ischemic area increases, and the exercise tolerance of the patient also increases. See, very interesting question, Dr. Shashwatji. Uh, Amla rasa is called as Hridaya, and there are two meanings of Hridaya. One is something that you like, appetizer sometimes. Hriday there means the man. So mana or manas is one, translation of Hriday. But practically speaking, medicines which have a lot of citric acid or amla ras, they are vitamin C. I mean, vitamin C is quite useful for the heart, overall heart health, and it has lot many other actions too. It keeps the blood, thin, and then antioxidant effect is there. You might be quite aware of the antioxidant properties of it. And free radicals, they result in a lot of oxidative stress, and that oxidative stress is the cause of many diseases, including the blockages. So somebody who consumes a lot of vitamin C or amla or orange or anything may have less chances of developing the coronary artery blockages, just because those free radicals did not have the opportunity to damage the cardiac the endothelium. So amla ras is quite effective so far as heart is concerned, but for me it is vitamin C only, and not all the amla rasas.
Okay, sir. So last question.
Yeah. See, lot many people still believe that Krimaj Hridroga means there are certain worms inside the heart. So I don't think that there are worms inside the heart. But a better thing would be if you go by the description of Krumij Hridrog, you will find acute myocardial infarction. So maybe that ancient acharyas, they looked at the heart. There might have been some hole because of the uh, infarcted area inside the heart, and they might have thought of speculated that there are cremies. But actually speaking, this whole description mimics a lot to the acute myocardial infarction, and that is what we get from it. But again, if you think that crimmage means infection, then it becomes more an subacute bacterial endocarditis or viral myocarditis or viral the bacterial myocarditis or things like that, or uh, pericarditis is there because of tuberculosis or some other infections. So the best way is you use this Krumij Hridrog in place of acute myocardial infarction, and the whole thing becomes very clear.
Thank you, sir. Thanks a lot.
Thank you.
I hope questions are clarified. Hands that serve are holier than lips that pray. We, the doctors, serve lots of people in our career. But Dr. Vasishta sir has served thousands of people and also saved many lives over 40 years of his holy career. Sir delivers lectures to share his clinical experiences and knowledge to boost confidence in budding doctors. Through their Vasishta remedies, they manufacture result-oriented, scientific, and safe Ayurvedic medicines to encourage practitioners. You are true inspiration, sir. I wholeheartedly thank you on behalf of Department of Postgraduate Studies in Kaya Chikitsa, GMC Mysuru. And we are really grateful to you, sir. Now, I would like to call once again Dr. Sangeeta to give vote of thanks.
Thank you.
Very good afternoon to everyone. It gives me an immense pleasure to deliver a vote of thanks for this session. On behalf of Government Ayurveda Medical College, Mysuru, I express my sincere thanks to our guest speaker, Dr. Vasishta sir, for providing us such a wonderful session and changing our perspective in regard to cardiovascular system and handling the diseases. Thank you very much, sir. I would also like to thank our principal, Dr. Radhakrishna sir, for being a constant support to us. I extend my heartfelt thanks to our beloved HOD, Dr. Maitri ma'am, for being a constant support and guidance. I would also like to thank the staff, PG scholars, for having a great teamwork. Lastly, I would also like to thank all the virtual participants for their active participation. Thank you, one and all.
Thank you. Thank you very much.
Thank you, sir. Thank you.